So we're going to talk about sexuality and the basics of nursing assessments and what to know and what is normal about sexual health. All right, so let's do this. Okay, so the first thing I want to just do is just explain the whole physiology thing. Men versus women. Men are from Mars. No, I think it goes the other way around. Women are from Venus, men are from Mars, whatever, Jupiter, whatever you want to call it. Okay, so here it is. The hormones you're going to want to be seeing is estrogen and testosterone. Estrogen is more associated with women and testosterone with men, but women still need testosterone to have normal libido levels. Oxytocin is associated with your orgasm, and progesterone and prolactin and cortisol is associated with decreased desire, decreased libido in both men and women. All right, so we also want to know what are the normal healthy behaviors of sex, and number one important, the most priority we want to focus on is being present. Being present is like our number one priority in order to have good, healthy sexual relationships. All right, authenticity, intense emotional connection, our sexual, erotic, intimacy, excellent communication, and transcendence. This is what you're supposed to get out of sex. If that's not happening, talk to have good communication between nurse and patient relationships. All right, so I also think it's really important terms to know would be sexual orientation. That means orientation. Who do I prefer? Gender identity is what gender do I want to be? Am I masculine? Am I feminine? What gender do I prefer to consider myself? That's basically what I'm saying. So I consider myself feminine. That's that's saying this is what I want to identify with. Now, sexual identity is your biological one, the one you're born with. You're stuck. That is your sexual organ. Gender is more associated with, think of masculine and feminine energies. Like, what do you want to consider yourself? Your vibe. Okay, so now that you understand that, I'm just going to quickly go over this. There's 5 stages of sexual responses. It's created by the phases of sexual response cycle is known as the Masters and Johnson. So just know this, there's an arousal and desire initially, and then you're gonna have the excitement. So that's gonna, excitement is our erections in men, vasocongestion and myotonia in women. Well, actually vasocongestion stage. The plateau stage is when in men plateau would be the emission, whereas the orgasm would be that ejaculation time frame. The resolution is that refractory time frame. Then men just are like, basically they need to rest their, you know what? Okay. Their penis has a refractory time. So that's when I was going to explain the sexual physiology of a man. The females go through only 2 stages, while the men go through 1, 2, 3, 4, 5. And so you think us women and men are literally on different cycles, and we're trying to, that's why we have to have excellent communication in order to reach that orgasm at the same time. Okay, so basically female vasocongestion, stage number 1. Stage number 2 is myotonia. Vasocongestion, lubrication of the vagina. Myotonia is when basically that relaxation and you get that contraction. So that's when the orgasm is happening. It will contract over the penis to help suck in that sperm to go into make a baby, if that makes sense. Men, they're gonna first have stimulation, then they're gonna have an erection, which is excitement. Emission is that plateau, and then ejaculation is when they actually orgasm, and detumescence is that refractory period of when they need to recover. Okay, so now let's also review over just briefly that there's different models for assessing, and it helps nurses to know, because you go into there and then you're like, how do I ask a sexual question? It's really awkward, especially for people young like me. I just I don't know. It's just, I don't know. There's a stigma to asking sexual questions, and I totally understand that. And it's just really important to validate a reason why to bring up sex, because especially when you're a 21-year-old and you're just yeah. It doesn't seem like an appropriate question, but actually it really is validated. So always remember, just when it comes to assessing for sexual questions, the open-ended questions are the best, and they get the patient to start talking. But sometimes you need to trigger that and get questions rolling. So there are models that help. So the models that help are called, so first you're going to do a permission. Permission is stage number 1. So you want to suggest sexual discussion issues, mention sexuality changes that will help, while also mentioning cancer risks, and makes the client think about the two together, and like maybe a pap smear, like get the ball rolling a little bit, and that will get the patient permission, because you want to make them feel comfortable and you don't want to make them feel awkward, like why are you asking them a sexual question, because you're trying to stay professional. So that's also really important, especially when you're talking about the concept of interpersonal relationships. So where are the boundaries? Give the patient very limited information about the sexual changes that can stem from the treatment. So for the specific treatment, don't give them like a whole overarching like everything, and they're just like overwhelmed, like why are you giving me all this information? So give them limited information that is associated with their treatment plan. Give them specific suggestions. So make a specific suggestion when the nurse is clear about the problem. So if you're clear as a nurse about the problem, that's when you can give a specific suggestion, such as like when it comes to like over-the-counter medications, like example, vaginal lubrication. I have a dry vagina. What should I do? You could suggest them lubrication over the counter for vaginal dryness. So that's like when you're really clear about the problem. If you're not clear about the problem, that's when physician's area. The next one is intensive therapy. If the patient needs more therapy, the nurse can provide referrals for the patient to a psychologist, a social worker, or a psychiatrist. So the 4 I want to say is this is called the PLICIT model. P stands for permission, LI stands for limited information, SS stands for specific suggestions, and T stands for intensive therapy. So that's the PLICIT model. Now, there's another model. So that was a PLICIT model, supposed to help with just a model for assessment and interventions. So that model helps with knowing what assessment to assess and to get interventions going. The 5 Ps assessment is more associated with to get that sexual history from the patient. So you want to know about the 5 Ps. What sex is their partner, and yes, you should be asking those questions. Are the men, are with the females, are they with multiple partners, do they just have one partner? This makes a difference in what you're assessing for them. Ask them their practice. Do they have oral sex, anal sex? And I know the patients may feel uncomfortable, but that's really important, because think about STIs. They may think, oh, oral sex is not a big deal, but they need to be checked for things like, especially in their mouth still, oral pharynx area. The prevention of pregnancies, if they're at age, prevention of pregnancies, know that oral contraceptives are options, and protection from the STDs. The only protection out there is condoms, and they need to be educated that oral contraceptives don't prevent from STDs. And if there's a past history of STDs. So you want to get a full sexual history on these patients. The main things to also monitor for and assess is the number of partners, the sexual satisfaction of the patient. I mean, this matters. It's like they think, oh, I'm just being selfish. I don't feel like I should be telling a physician if I'm sexually satisfied, but really, that's really important, because they can only help improve their sexual health if they're really open and honest with their nurse. So get them to feel comfortable. And frequency of activity. Other assessments would be saying gravida versus para. Gravida stands for how many pregnancies there were, like I think of like got knocked ups for G, and that stands for basically how many pregnancies, including the miscarriages, where para is how many births were there in general. So that's really important. So this is just getting an overall basic understanding. So we talked about the the physiology, the understanding of sexual physiology, and the assessment. So now we can talk about just what is the whole gender development and what to expect from each stage, and how as a nurse are you going to intervene for just the typical client, because everybody needs help, with every body system. So birth to 18 months, you're going to teach the patient that self-manipulation is expected behavior at this age from birth to 18 months. So gender assignment, this is the time frame where there's gender assignment, the beginning of gender identification starts at this age. So if parents are concerned about their child touching down there, it's not abnormal. It actually is a very normal, and the parent may question something, so just reaffirm that that's normal. 1 to 3 years of age is like the official time frame when really the toddlers need interaction with both a male and female adults. self-exploration is expected as well in this age, and gender identification and ability to identify with one's own gender starts to happen in 1 to 3 years of age. So 3 to 5 years of age, provide simple and direct answers to all the child's sex questions. Do not respond negatively to the child's exploration. Increased self-awareness happens at this age. Start asking questions associated with one's sex. So they start to ask questions more about their own sex, like why am I a girl and who is she boy? Like, you know, like you start to like question those things. Now we're going to talk about 6 to 12, that was our preschool, and now we're going to go to our elementary school age. So the nurse is going to answer questions, or the parent, sex questions, honestly provide written information. Participation in same-sex friendships at this age, question about the opposite sex, which makes sense because my sister's 10, and yeah. 13 to 18 years old, this is when the value system is established, the development of sexual characteristics, exploration of like, do I like boys or do I like girls, you know? So like basically that's when that starts. Who do they like, basically? All right, so recognize the influence of peer groups, influences, the relationship with the opposite sex. This is when it sets the stage for the future, so that's really important to know, and that they have healthy relationships, and that because this will determine how they react in the future to their future relationships. Also, if they are sexually active, make sure to ask, because you never know. That teach them about pregnancy prevention and STD prevention as well. 18 to 40 years of age, this is when active sex life is the most common and possible. It's also possible technically 13 to 18 year gap, but it's more common in 18 to 40 years age. Provide information on the pregnancy prevention and STDs as well in this stage. It's the most major thing. 40 to 65 years of age, the reduced male and female hormones, so the female may feel like they're less interested, altered libido. The role adjustment occurs in response to female stresses and psychological changes. They may be a sandwich generation, they may experience stress, to family stressors, physiologic, they have menopause. For women, men may just be decreased, less hormones as well. 65 years and above, they have a continuing interest in sex. Be aware of that, but they may have a reduced frequency. Recognize that the older adult has a continued sex interest, and teach adaptation techniques. They may be not as mobile, maybe tired more often, and teach them that they're still at risk for STIs. They're not exempt, so that's really important. Often there's abuse in nursing homes and stuff, so be aware of that. Monitor them for that, but if they're older and they think they're exempt from STIs, definitely re-educate them. So that is the overview of sexuality basics and assessments, what to expect from gender development, all the physiology that is associated with sexuality characteristics. And so that's the overview. So happy studying and enjoy.